Arizona has an initiative to improve literacy and school readiness, but for some families, the help their child needs early in their life is out of reach.
State-funded early intervention programs only serve a small percentage of children. And if a child doesn't qualify, well, then families can be left paying hundreds of dollars a month out of pocket. Nohelani Graff shows us how that gap is affecting families and what advocates say needs to change.
Those early years are critical for brain development, but Arizona has one of the strictest qualifying rates in the country to demonstrate a developmental delay to get kids help. I spoke with one mom who says even knowing the system wasn't enough to get her son the support he needed.
We do work on it a lot, and he has progressed.
For Griffin, learning looks like this: playing, exploring, and practicing his words.
What color is that? It's pink. It is pink.
That's a big one because getting him the help he needed to get here wasn't easy.
We had him evaluated through the early intervention program twice, specifically for speech language. He wasn't meeting the milestones that he should have when he was 1 year old and 2 years old.
Kirsten Pollitt works in early childhood policy at Children's Action Alliance. But as a mom, she says she ran into the same wall many Arizona families face.
Criteria for the early intervention program is you need a 50% delay in one or more areas in order to qualify for the program.
Even though Griffin was clearly behind in speech, he didn't meet that threshold.
Instead of saying he was hungry or a certain food that he wanted to eat, he would drag my husband or I to the pantry, say up, and then point to what he wanted.
So instead of state support, the cost fell on the family.
$400 a month that we paid for him to receive a 30-minute speech session. I know not a lot of families aren't able to do that.
Advocates say it's a statewide gap.
We serve less than 3% of infants and toddlers in the state.
Last year, about 16,000 children were referred for early intervention. Only about half were served. And missing that window can have lasting impacts. Speech is one of the biggest indicators of whether a child will be reading on grade level by third grade. Programs through First Things First help fill some of those gaps, but their funding is shrinking.
We need to continue to work with the legislature and ask them to prioritize Arizona families, ask them to prioritize babies, toddlers, and preschoolers in the state.
You're my little cookie.
For Kirsten, the answer was clear.
When they're in those really crucial years, every single second counts.
For others,
families really shouldn't have to choose between basic necessities and being able to find services for their child.
it's hard to find the words for a choice like that.
But that's perfectly okay.
Some perspective here: Arizona's delay eligibility, 50%. Most states are 33%, the most inclusive. New York and Massachusetts at 25%. So basically, kids qualify for help earlier before it becomes a severe impediment. Now, as for funding, they are working to expand the tobacco tax here. We told you about that last week. And in the meantime, if your child needs support, you can request an evaluation through Arizona's Early Intervention Program. I'm Nohelani Graff. That's your Education Impact for 12 News.